Good afternoon. My name is Dion Miller, and I will be your host for today's February 2025 monthly relationship building hour. Today's presentation will be recorded for future attendees. I ask that you please mute yourself now. I will take time to answer any questions you may have at the end. Feel free to add them in the chat as we go. You are welcome to leave your camera on or turn it off. All right, let's begin. Here's a fun fact. Sleep divorce is one of those things almost no one talks about. In fact, many of my couples come into session in the first session or two and share that they and their partners sleep separately. They say so with hesitance during couples therapy. So today we're going to look at it. What is sleep divorce? For a sizable percentage of couples, sleep divorce has been a game changer. Today we are going to deep dive into what it is, how it affects the marriage, and how to get through it restfully. After today, we may just be ready to reframe a sleep divorce to a true sleep alliance. Quick disclaimer. I want to take a moment and advise you that this workshop is psychoeducational, meaning that it was designed to serve as a teaching and guidance for you and is not a replacement for couples therapy. If you wish to pursue counseling, please do not hesitate to reach out to our team at Connected Couples Counseling for more information. As a licensed therapist, my team and I are available for couples counseling for residents in Washington State. Alternatively, we are more than happy to help you locate a couples therapist who is trained in your area. If you believe that you or your partner are struggling with a steep sleep disturbance, please reach out to your healthcare provider for more information, diagnosis, and/or treatment if appropriate. Okay, let's get it started. By the end of today's Connected Couples Counseling Monthly Relationship Building Hour, I hope that you will have learned a little bit more about who we are as a counseling provider in the state of Washington, a bit more about the science of sleep, some sleep challenges, and of course, what is a sleep divorce, and some look at if sleep divorce is right for us, both the pros and the cons, and finally, the frequently asked questions, also known as what about sex? First of all, let me introduce the team that I am happy to work with. Connected Couples Counseling is a small group practice providing telehealth therapy for those of us living in Washington State. Rachel, on the far left, is the owner of our practice. She specializes in rewiring attachment dynamics in couples. She is also available for relationship coaching for those not wishing to go to the traditional route. Megan, in the middle, she is our clinical intern, and she is passionate about supporting couples and families. And she has a very special place in her heart for single parents. And me, Dion, I'm our life transition specialist. And perhaps it's from that, in addition to a few other things, why I am so passionate about sleep. Because when is it at life transitions, such as when we are the parents of a new baby, or when we are parents of teens, or as we reach into retirement and the aches and the pains may keep us up at night, that we encounter sleep challenges? I became passionate about the subject of sleep and mental health very early in my therapist career. In addition to working with couples, I have worked with many individuals who struggle with symptoms of anxiety and/or depression. I quickly learned that the role that sleep plays in our journey towards mental wellness, and I provide psychoed on sleep and sleep hygiene to many of my clients. Because if sleep doesn't serve an absolutely vital function, it is the biggest evolution mistake ever made. So, why do we need sleep? Sleep is essential for human health and survival. It helps with brain function. Sleep allows us to have neuroplasticity. It allows our brain to adapt to new information. It is a vital role in our memory formation. It helps create and maintain the pathways in the brain to allow for memory and learning. And it is vital in the removal of waste. Every day, our brain accumulates waste, and sleep helps us remove the toxins and waste products from our brain. Sleep is also vital in our physical health. Sleep helps regulate our metabolism, which can affect our weight and increase our risk of chronic disease. It helps with our immune system. Sleep helps our body produce proteins that fight infection and inflammation. And also, without sleep, it affects our health and our heart. Sleep maintains our health and our heart and health and our lungs. And finally, other benefits. Mood. Sleep can help improve our mood and reduce our stress. It helps us make better decisions, and it helps in growth and development, particularly in children and teens. So, what happens if we don't get enough sleep? Lack of sleep is a health issue that deserves your attention and your doctor's help when appropriate. Not getting enough sleep due to insomnia or a sleep disorder such as obstructive sleep apnea, or simply because you're sleeping, getting no sleep because of your partner or yourself, or you're out late every night, it can affect your mood and your health in far-reaching and surprising ways. Sleep deprivation can affect your judgment so that you don't even notice its effects. For example, memory issues. Sleep deprivation increases your risk by 33%, your risk of dementia by 33%, and over time can age your brain 3 to 5 years. It increases your challenges with thinking and concentration. It changes your mood. Sleep deprivation increases your risk of depression, anxiety, irritability, brain fog, impulsivity, and challenges you with emotional regulation. We know that up to 6,000 car crashes that are fatal every year are caused by drowsy drivers. And 1 in 25 adults has admitted to falling asleep behind the wheel every month. Weakened immunity. With sleep deprivation comes less active natural killer cells, and you are more likely to catch a cold by 3%. It raises your blood pressure. It nearly triples your risk for developing type 2 diabetes. It increases weight due to changes in your hormone levels that turn on and off your signals for hunger. It lowers your sex drive. It increases your risk of heart disease, and it increases poor balance. So, how did you sleep last night? On average, adults need 7 or more hours of sleep every single night. Chances are good that you didn't sleep great. Me, I woke up at 4:30 this morning because I was thinking about this presentation. I came in at a whopping 6.5 hours, which isn't terrible. It's also not great. And I, for better or worse, joined the other 35% of adults who reported sleeping less than 7 hours on average. Almost half of us will fall asleep without meaning to at least once a month. About half of all Americans say that they feel sleepy during the day from 3 to 7 times a week. Up to two-thirds of adults occasionally experience insomnia symptoms. And if you're an older adult, white or female, you are more likely to feel less rested. So why are we not sleeping? Sleep challenges come from a variety of factors. Our lifestyle and habits contribute heavily to our quality of sleep. Maybe our schedules change. We have shift work, jet lag, time changes every 6 months. Maybe we've got a lot of pressure at work, deadlines, kids, stress, life. Maybe the sleep environment is noisy due to outside traffic, television, or any number of things. And we all tend to use a lot of electronic devices too close to bedtime, or we keep them in our bedroom. Other factors could include having sleep problems such as sleep apnea or having chronic pain. Maybe we're caring for another person at night, our partner, our children, an older adult in the home. Maybe we have medical conditions. Maybe we suffer from stress, anxiety, depression, PTSD, or ADHD. Medications, caffeine, alcohol, or recreational drugs all play a role in our sleep challenges. And if you're sharing your bed, their sleep challenges quickly become your sleep challenges. A quick note about sleep disorders. Sleep disorders play a role in the lives of many. If you suspect that you or your partner or a loved one have a sleep disorder, I urge you to seek medical assistance from a trained, licensed professional, as there is help available. Here are some quick statistics. There are over 80 different types of sleep disorders. These disorders can make it difficult to fall asleep, stay asleep, or get restful sleep. About 50 to 70 million Americans have chronic or ongoing sleep disorders. And insufficient sleep, that's the people who are sleeping less than 7 hours every night, that's the most prevalent sleep disorder. It is at this point I encourage you to learn more about sleep hygiene. While it can't prevent all sleep disorders, sleep hygiene goes a long way in helping improve sleep. Sleep hygiene refers to the steps, lifestyle behaviors, and activities we practice daily that can help promote high quality sleep, such as limiting alcohol and caffeine, eliminating screens before bed, creating a wonderful bedtime routine, and limiting those naps to appropriate times of the day. For some of us, a sleep divorce is not even a blip on the radar. Studies have shown that sharing a bed with a partner is associated with multitude of feelings: comfort, warmth, security, and calm. A small number of studies have also found potential benefits of sharing a bed with a partner, noting increased REM sleep, better sleep efficiency, and more overall sleep compared to those that sleep alone. And if that is you, that is fabulous. I admit, while preparing for this lesson, my husband caught a cold, and I honestly considered a sleep divorce after a few nights of lost sleep. And surprisingly, we would not have been alone. According to a survey undertaken by the American Academy of Sleep Medicine, more than a third of Americans have opted for a sleep divorce, at least occasionally, with millennials leading the way at 43%. So finally, you're asking, okay, a sleep divorce, what is it? A sleep divorce refers to a situation where, as a couple, you both choose to sleep in separate beds or rooms rather than sharing the same bed. Also frequently known as a sleep alliance. There are a lot of reasons, as you can imagine, after reading the different issues with sleep, that a couple may opt for a sleep divorce. Different sleep habits. Partners with incompatible sleep schedules or preferences, such as one person being a light sleeper and the other heavy snorer. Also, I'd like to mention that a lot of new parents find a sleep divorce really helpful so that at least one parent each night gets a good night's sleep and the other is able to wake up and take care of the young baby. Sleep disorders. As we've already discussed, conditions like sleep apnea or restless leg syndrome can disrupt a partner's sleep. Relationship issues. Stress, arguments, or emotional distance can make it really difficult for a couple to continue to sleep together. And personal preferences. For some people, they simply prefer to sleep alone for various reasons. And these are just a few of the reasons. I'm sure that there are many other reasons, and those reasons are as unique to every couple as they are to each person. There's benefits. A sleep divorce can be a viable option for couples who are experiencing sleep disturbances or incompatible sleep habits. However, it's important to weigh the potential benefits and drawbacks carefully and consider all of the factors involved before making a decision. First of all, improved sleep quality. Sleeping in separate beds can allow partners to adjust to their environment, to their individual needs, leading to better sleep. In reduced stress and irritability, avoiding sleep disturbances caused by a partner can improve mood and reduce stress levels. And this one may surprise you, enhanced intimacy. In some cases, a sleep divorce can provide a sense of privacy and allow partners to focus on their own sleep, which, as we'll discuss, more sleep can actually lead to more intimacy during the day. That said, there are some drawbacks. As we discussed, many of us picture when we think about being in a relationship and co-sleeping, we think of that warmth, that comfort, the cuddling. And when you're sleeping in separate beds, there can feel like there's that loss of companionship. Sharing a bed does and can foster intimacy and emotional connection. There is the potential for misunderstandings. If not communicated effectively and communicated often, a sleep divorce can be misinterpreted as a sign of disinterest or a lack of affection. I'd also like to add that often or occasionally I see where couples get into trouble if they don't communicate really, really well about what is accepted, that in occurrences that happen during separate sleeping times. Finally, increased costs between maintaining separate bedrooms, buying a home or renting an apartment with more bedrooms, all of that increased costs, and those costs can add up. So, what are some considerations before you decide if a sleep divorce is right for you and your partner? It is good to remember sleep divorce is not a one size fits all approach. There are many considerations before deciding if it is a right step for you. Let's take a look at these. Communication. Open and honest communication, as we just hinted at, is crucial before considering a sleep divorce. The trial period. Before deciding if a sleep divorce is right for you, I highly recommend a trial period for an agreed upon period of time, a week, maybe 2 weeks, to see if it is truly improving your sleep quality and your overall well-being. Then I encourage couples to assess it regularly. Things change. Perhaps your baby is grown and you can both sleep better, or with the help of a CPAP or a BiPAP machine, a person who was previously struggling with sleep apnea may find that they are snoring less, and again, the couple can rejoin one another. Maintaining intimacy. I know this is a big one for many couples. In order to make a sleep divorce truly work for a couple, you have to make a plan to prioritize quality time together during the day and maintain that strong physical connection that you would normally get while co-sleeping through intentional intimacy. And finally, if sleep disturbances are related to underlying health conditions or relationship issues, I urge you to seek professional help, either from a therapist if it's on those relationship issues, or from a doctor. So, what about sex? I know you're all wondering, how does that work? I used to wonder too. With a sleep divorce, couples really need to make sure that they communicate their needs and desires for intimacy. It may require using a calendar or scheduling sex, saying Sunday nights, Saturday nights, Wednesday nights, whatever nights works for each couple. Some couples find that using a keyword or signals for those spontaneous booty calls could be helpful and even a little enticing. The factor here is communication. On the flip side, while spontaneous lovemaking in the middle of the night may be slightly more challenging if you're in separate bedrooms, it is good to remember that getting enough sleep decreases your risk of sexual dysfunction and can increase a woman's desire for sex. Again, it all goes back to communication. What are the rules? Are there rules? If a couple decides to have a sleep divorce, communication on the rules may be important, such as, are occasional sleepovers okay? Maybe we sleep together on the weekends and just not on weeknights when we really need to be able to fully function. Where do we have sex? My room, your room, the living room? What if we change our minds? Those are all vital, important questions about the rules. And I urge my couples to have conversations on privacy, boundaries, and perhaps even re examining the monogamy agreement, such as, is porn okay? Is masturbation okay? Do we need to look at those things? Or are the same rules that applied previously when we co slept also applying in our current situation? Uh, when is it time for a sleep divorce? The time varies for each couple. For some couples, a sleep divorce is not ever wanted or needed, and that's great. For those partners who work different hours, maybe such as the night shift and a day shifter, they may benefit from a sleep divorce. Um, let's see. Snoring is a really common reason why couples choose to sleep in separate rooms. Just remember, snoring is a common symptom of sleep apnea, so it's important to be evaluated by a sleep specialist if snoring is interfering with sleep. Lastly, be prepared for questions from your kids, your family, and even others. I have a dear friend who has always slept separate from their partner, and they shared with me that they have had a lot of questions throughout their 30 years of marriage. This friend shared over the years they have received questions from their kids' friends, and anyone who enters their home. What you tell others is entirely up to you. This couple has embraced the questions with love and humor. Not ready for a sleep divorce? not sure that a sleep divorce is right for you, there are a lot of alternatives to sleep divorce. Not ready for separate rooms? You may find that the Scandinavian sleep method may help you navigate some sleeping challenges. Instead of sharing one comforter, the Scandinavian sleep method, each partner gets their own duvet or blanket while sharing the same bed. This option is really helpful if you or your partner have different temperature preferences, or if one of you tends to steal all the blankets like a little burrito. Wink, wink, I'm looking at you, husband. And then you both have the blankets you need. Earplugs and sleep masks. If a snoring partner is just plain and simple too loud, or if your partner leaves the television on all night, I highly recommend you get yourself a pair of earplugs and a sleeping mask to block out the light if sensitivity is an issue for you. You may find that these small changes are big enough differences to keep you and your partner in the same bed. Sound machines. Not a fan of earplugs. Different sound machines emit different sound frequencies that can assist sleepers. Personally, I love the 8 Hour Sleep podcast. Other people love the noise of a fan. Split King. Okay, so this might require a little splurging and a little more space, but think of having a split king as having your own bed while still sharing a bed. A split king is essentially two extra large twin mattresses combined into one king size bed. Pair it with an adjustable base, and you've got the ultimate customizable setup where you can each control your side and you can choose different firmness levels. And finally, and of course, like I have repeated so many times, address those underlying conditions. Sometimes sleep troubles point to deeper health concerns that truly need your attention. There is no one size fits all solution for sleeping. For some, co sleeping is the best. And for others, a sleep divorce truly creates a sleep alliance. Thank you for attending today's Connected Couples Relationship Building Hour. At Connected Couples Counseling, we are here to help. Please call or email us. You can find us on the web at connectedcouplescounseling.com. If you're thinking about a sleep divorce, and that it might be right for you and your partner, and you'd like to talking about it, if you'd like more information about sleep hygiene, or if anxiety is keeping you up at night, please do not hesitate to reach out. And next month, I urge you to join us as we explore recapturing romance. Thank you.